is Olivia Anderson, and I'm in the FNP-DNP program at Gonzaga University. I would like to tell you about my proposed clinical service, which is the Center for Palliative Care. Let's start by defining palliative care. According to the World Health Organization, palliative care is an approach that improves the quality of life for patients and their families facing problems associated with life-threatening illness through prevention and relief of suffering by means of early identification and treatment of pain and other physical, psychosocial, and spiritual problems. So, essentially, palliative care is supportive care for people of any age and at any stage of illness. Before we go any further, let's look at the background of chronic conditions in the U.S., since they're among the most common and costly health problems. Roughly 50% of Americans, 117 million people, are living with one or more chronic medical conditions, and that was of 2012. In California alone, 14 million adults are living with at least one chronic condition, and over half of them have multiple chronic conditions. People are living longer and getting sicker. Many of them need the extra layer of support that palliative care provides. The field of palliative care has rapidly expanded over the past 20 years, reaching over 1,700 hospitals by 2012. Over 90% of U.S. hospitals offer palliative care services, yet only a fraction of the patients who actually need it receive it. What we need now is for palliative care to expand beyond the hospitals to patient homes, nursing homes, doctor's office, cancer centers, offices, and other community settings where millions of seriously ill people live and need our help. Sadly, it's not uncommon for chronically ill patients to end up at the hospital with out-of-control symptoms, and that's the only time they're seen by a palliative care team, or the only time their goals of care are discussed. But why wait for hospitalization to alleviate symptom burdens? That's why I'm seeking funding for my proposed clinic, the Center for Palliative Care, or CPC. CPC stands in the gap of healthcare for patients who are ill, but not ill enough to be on hospice or require hospitalization. CPC's mission statement is to maximize the quality of life for patients and their families, thereby empowering them to live life to the fullest. In pursuit of this mission, CPC values connecting with patients and learning their story, collaborating with patients as partners, building a community of support, finding creative solutions to challenges, and showing compassion above all. Our customer segment is adult patients in California with chronic or severe life-limiting illness with uncontrolled symptoms, as well as their families and caregivers seeking support and resources. Key activities at CPC are targeted towards three main groups of people, the first, of course, being patients. Providers at CPC will have one-on-one consultations with patients to establish their individualized goals aimed at pain relief and symptom management. CPC is committed to connecting patients and families with information and resources for everything from understanding their diagnosis to grief and bereavement support to advanced care planning. CPC also offers educational opportunities for primary care providers to learn about palliative care, as well as training opportunities for medical, nursing, social work, and chaplain students. CPC will partner with a few organizations to share education and resources. These include primary care providers, the Center to Advance Palliative Care, the Coalition for Compassionate Care of California, and Stanford Healthcare. These organizations are critical to CPC's success. So now let's talk about the cost. Each year, the U.S. spends about $2.2 trillion on healthcare, and chronic illness accounts for about 75% of that. In other words, we spend about $1.65 trillion every year treating patients with one or more chronic diseases. So how do we cut costs? Having a Center for Palliative Care will help healthcare systems save money by reducing ER visits, shortening ICU stays, and decreasing unnecessary readmissions. Effective palliative care results in fewer symptom crises, which reduces hospital utilization. A study of terminally ill homebound patients found that the average cost of care for those receiving palliative services was less than half the cost for those without palliative care services. According to the Center to Advance Palliative Care, numerous studies show that palliative care significantly improves patients' quality of life and lowers their symptom burden. Apart from being the right thing to do for patients, there are substantial cost savings associated. Funds for CPC will be allocated towards compensating the nurse practitioner, RN, social worker, medical assistant, administrative assistant, grief counselor, and any printed educational materials for patients and families. The monthly cost will be $8,900. So, why should you invest in the Center for Palliative Care? Our hope is to provide care for all patients, regardless of their ability to pay. To do that, we need investors and donors like you. To illustrate the importance of investing in outpatient palliative care, I'd like to share with you the story of a patient we'll call Jane. Jane will be 87 years old this year, and she lives alone in the house where she raised her children. When Jane was 82, she was diagnosed with a slow-moving breast cancer, in addition to the vascular disease that she already had. Despite these serious conditions, doctors did not think Jane was near death, which meant her Medi-Cal plan did not cover palliative care services. At least 3 times over the last 4 years, Jane developed wounds on her legs due to her vascular disease that required intensive rounds of treatment at the hospital. Had Jane been seen regularly by a palliative care team, it could have not only prevented the wounds from developing, but saved tens of thousands of dollars in treatment. Jane became eligible for hospice last year as her overall health deteriorated, which entitled her to the services of a visiting palliative care nurse. Since then, Jane's wounds have been under control and she hasn't had to go to the hospital once, which she is very happy about. Together, we can restore hope for patients like Jane, whether hope means being cured or living as comfortably as possible for as long as possible. And by defining patients' hope, we can then in turn maximize their quality of life and empower them to live their life to the fullest. I hope it's clear the value that palliative care adds to healthcare for investors, providers, and most importantly, for patients. Thanks for watching.